So we did a survey of pediatric PTs who did the big transition to telehealth during the COVID-19 pandemic. And so we found that we had a really nice response to our survey. We had 259 respondents, and they found that they were able to deliver telehealth to their patients during this time, and that it wasn't necessarily their favorite thing that they did in all cases, but it was a way to continue to provide these essential services to families and children in a time when we couldn't be in person with one another. And I think that doing it in this context of a pandemic kind of accelerated our ability to, adopt to this telehealth model. And I think we learned a lot about telehealth that's going to allow us to kind of move forward and maybe use it in different ways as we kind of get back into in-person services with each other.
Now you've been able to do a pretty comprehensive survey. Could you take me through what exactly you did to make this survey happen?
Sure. We developed a survey. I was working with one of our DPT students and her clinical instructor as she was on clinical and it was in April of 2020. So they were in the situation exactly like we're talking about, where they had to make this quick transition from in-person services to telehealth almost overnight. And so they were really curious about how this was going across the US for other PTs. So we kind of worked together to really quickly put together a survey. And because we did that, I think the survey ended up being kind of big. So we had 41 questions, but we had so many things we were curious about. It was hard to kind of pare it down. And so this manuscript actually covers 4 questions that we had, and it was related to what factors the pediatric PTs felt were important for effectiveness of telehealth services, and then also what they thought of as the facilitators and barriers to providing effective telehealth.
Right. Could you give me some insights then into the data that came out of this? I mean, the factors affecting the effectiveness of telehealth and also these facilitators and barriers. You have, in fact, as a cohort of physical therapists, learned a lot, haven't you?
Yeah, we definitely have learned a lot. What was kind of interesting to us is we expected technology to be a big facilitator barrier factor as far as effective telehealth. Because if you didn't have that technology, if you don't have access to appropriate devices, access to Wi-Fi, it's just not going to be possible to provide telehealth services, right? So that was a huge piece. But the other piece that came out was the idea that the caregiver had to be really engaged. And that was a huge kind of finding for us. This idea that we went, and I think depending on the model of physical therapy that we're doing in pediatrics, what setting we're in, we already are really good at engaging our caregivers, but it took it to a new level because as the PT, we were watching from a screen, but we couldn't have our hands on the child at that point. So we were really depending on the caregiver to be hands-on with the child and also to be our eyes and our ears and to be able to set up the environment in the way that would be effective. And so in many ways, I think that the perception by our respondents was that the caregivers came away feeling even more empowered to be able to care for their children because they were doing it and they were the primary provider during this telehealth session. The other piece of that was really nice was our PTs were able to really see a window of what was happening in the home environment, what the home environment looked like. And, if we're seeing a child in the school, we're seeing a child in a clinic, we don't always have that insight to the home environment that we got during this telehealth period as well.
Now, what have then been the benefits and what could be even better benefits from what you've learned?
Yeah, so I think that we found that there's a lot of really great things about this telehealth model. And I think it's important to recognize that as we were looking at the responses from our respondents and these pediatric PTs in the US, we found that it wasn't like telehealth had to be an all or nothing proposition, right? It was something that we could use to kind of supplement what we do once we're back in the clinic, once we're back into providing care, maybe in daycares or schools. But it's an opportunity to be able to, again, see that home environment and maybe tweak a home exercise program and provide some education during like routines that the family would typically be doing with the child. It also is an opportunity to enhance communication with a caregiver that maybe we as PTs don't have the opportunity to do, depending on the kind of setting that we're in. And then also for our families that live in more rural areas or travel a long distance to get to their healthcare, or for PTs that travel a long distance to get to their families, it might be an adjunct to kind of decrease costs, decrease travel time, and we can be more efficient with what we're doing.
Right, so all of those benefits, but there are also barriers and drawbacks, and one of them, I'm sure, is access to broadband, access to an appropriate device. I mean, how did you cope with all of those barriers?
Um, well, I mean, it's one of those things that I think we really need to be looking towards the future with, as far as making sure that we're really thinking about the idea of access and increasing access to broadband, particularly for our families that maybe are in different socioeconomic kinds of areas, and then also in those rural areas that maybe don't have the access as well, because that is a huge barrier, and it's not something that maybe I, as an independent provider, can really change. It's something that we probably need to do more systematically um, across the board.
Going forward, do you see perhaps a blend of physical therapy emerging whereby you get hands-on face-to-face visits plus telehealth? And can you see a kind of optimum way of mixing the two to get an even better effectiveness of therapy than we have known in the past?
Yeah, absolutely. And this is something that kind of came out in some other questions that we have in the survey. So kind of a preview to some of our other results. But absolutely, I think we really feel like this hybrid model of in-person and telehealth services going forward is going to be really an important thing for us to consider. And it may be that as we think about how we provide services in our clinics versus how we provide services in early intervention versus how we provide services in our school-based settings, that we kind of use this telehealth and leverage this opportunity in different ways in order to provide the optimal care to our families and to our children.
So, if you were to summarize it in a nutshell, what would you say you have learned from this wonderful survey?
Gosh, yeah, so many things. And I think that it's one of those things where there's this silver lining kind of coming out of the pandemic for us as providers. I think that we really appreciated, and we were able to collect data kind of early on in the pandemic. So we got this picture of what this experience really was like. And it was obvious that our PTs were so passionate about being able to provide this service going to their families and children. And how can we do this in a safe way? So I think that was really huge. And I think that as we look at all these results, it's important to recognize that this, the data that we got happened during this pandemic. So we have to remember that that's coloring things, and that oftentimes these PTs didn't have a lot of training, they didn't have a lot of supports, and they were just doing the best they could going forward. So I think that going forward, with all this that we've learned about the effectiveness of telehealth and how it can be used, and it can be used in different ways, and we can be creative about it, that we can continue to kind of evolve as a profession and thinking about how we can support PTs, support families, and make sure that this is best practice and that we have all the tools we need to do this in a really effective way.